Good morning, everyone. My name is Carrie Van Dotsen, and my mentor for this program was Dr. Lee. My title is The Link Between Developing Depression and Childhood Abuse in the Elderly Population. So, our question was to look at how different coping techniques influence if older adults will develop depression and after suffering childhood abuse. We also looked to see if there's a correlation between experiencing childhood abuse and the way a person copes, and the possibility of developing depression as an older adult. The reason that we did the study was because, as we all know, depression is a severe illness. So we were looking to see if there was a connection between childhood abuse, of course, maladaptive coping skills, and depression. It is unique in the fact that we are trying to correlate something that happened to a young child to how it is expressed in older adulthood. We're looking at the different coping strategies and to see if they alter the rate of depression in the adult after being abused as a child. Previous research. Some studies of depression include guilt, hopelessness, frequent crying for no apparent reason, sadness, alterations in daily living. So we understand that child abuse can lead to cognitive scars. This was in the previous research that I read. And that these scars can increase a person's chance of developing depression. One study said that there was a higher association with emotional maltreatment and was strongly correlated with depression and a cognitive vulnerability, which would be a cognitive scar, essentially. These changes in cognitive style increase the chance of developing depression in otherwise healthy adults. These scars impact how these people live their lives, but it also impacts how they interact with others, their families, their children, and even their friends. These scars are there even if there's no evidence of current or past psychopathy in the individual. Excessive substance abuse has been linked to ways to self-medicate to keep thoughts out of their head when they're suffering from depression. People with mental illness tend to disengage in thinking about their problems, their illnesses and such. And this affects the ability of a practitioner or a treatment provider to provide adequate treatment. Child abuse can alter the neural circuitry, as we talked about earlier, and it also can cause the brain structures to be physically changed and altered. So that would be with the cognitive scars, and by understanding this and the way that the brains are altered, it will help us deal with how we develop treatments and treat with proper treatment, And then another study I found that signs of more depression with the elderly when they use self-blame, behavioral disengagement, and denial using the geriatric depression scale. The sample with depression who used more of active coping had less signs of depression, and when active positive coping is used, it tends to make a person less likely to have distress, while other styles of coping cause high levels of distress. So my study, the methods. We looked to see if childhood trauma and coping variables had a relationship with depressive symptoms in adults over the age of 65. The sample consisted of 265 older adults. It was secondary data that we used, and so the survey information came from the midlife development in the United States. For the dependent variable, we use the Center for Epidemiological Studies Depression Scale. CESD is made of 20 questions, and some sample questions would be, I felt lonely, I was happy, and I thought my life had been a failure. The CESD has been shown to be a reliable measure across different groups and populations. It has been shown to be reliable in measuring behaviors and depressive feelings in various previous research. The main independent variable we used was the Childhood Trauma Questionnaire, the CTQ, and the COPE inventory. The measure of childhood trauma was the CTQ. It measures neglect and childhood trauma abuse of participants. This test is divided into three parts, several parts: emotional neglect, physical neglect, emotional abuse, and physical abuse, and sexual abuse, sorry. All of these are a Likert scale. Some sample questions were: my family said hurtful things to me as a child. I was punished with a belt or other hard object. I knew someone who was there for me. We also looked at the COPE inventory to measure emotion-focused coping and problem-focused coping. Problem-focused coping includes 3 subdomains: active coping, planning coping, and positive reinforcement coping. Sample from each subdomain would be: I try to come up with a strategy about what to do. I think about how I might best handle the problem. And I try to see it in a different light to make it seem more positive. Emotion-focused coping includes subdomains as well. Denial coping, venting of emotions coping, behavioral disengagement coping. One example is: I pretend that it hasn't really happened. I feel a lot of emotional distress and I find myself expressing these feelings a lot. I reduce the amount of effort I am putting into solving a problem. Okay, so our results that we found from our study. We ran a correlation test and found that depressive symptoms in older adults was significantly associated with coping variables in childhood trauma. Higher depressive symptoms were significantly associated with higher emotional neglect as a child. Our sample had 9.5% of individuals whom expressed depressive symptoms. The sample showed that people with higher perceived health scores had significantly lowered depressive scores. So, in the study, they had 5,164 participants, ages from 65 to 84, with a mean age of 71.1. Because it was senior citizens, the employment rate was, as we would expect, 81% had no employment. And 89% said they had good, very good, or excellent health. So, the results showed that depressive symptoms were significantly negatively associated to active, positive reinterpretation and planning coping variables, while it was significantly positively related to denial, emotional, and behavioral disengagement coping variables. So some limitations. Obviously, this is a retrospective analysis of data, so we have to keep that in mind. And how we use the data. There could be other factors that are affecting the depression rate in this population. So some implications are that we hope that this will provide insight for practitioners as well as patients and how they deal with their childhood abuse, and teaching them the proper or better techniques to work on their depression issues. And it will allow the elderly who have been abused to learn better coping skills, we hope. That's all.